So as you know, this is the third episode in our series. We started off with talking about industries of the future. Dr. Mohammed Wael Abdelail from the Magdi Yaoub Foundation, and then we followed last Thursday, with Dr. Riyad Al-Manyous about what the cure is. And today's exciting episode, we are doubling up or tripling up on speakers that have very interesting things to say. And so we're going to have Dr. Mayrouz Dos, Shukri Al-Asmar, and Dr. Khalil Abdel will be moderating this interesting discussion. It's about where do we go from here with digital health. Next week is going to be our final one. We're going to conclude. We're very excited to actually announce that we're going to have Matthew Holt, the chairman of Health 2.0, tell us a little bit about what's going on in the world. Abdulatif Alama from Al-Tibbi is going to be talking to us about what he's seeing in the region, in the Gulf, and what's happening in the Arab world, places like Iraq that have been very interesting for him. And then Dr. Ahmed Morsi is going to take us into AI in healthcare. Is it hype or is it really what's going on today is the following. This is our agenda. I apologize for the pixelated agenda if you see it, but we're basically I'm going to be handing it over to Khalil to give us an introduction about the Great Reset of healthcare, and then he's going to engage Mayrouz and Shukri in a discussion. There's going to be some time for you guys to give us some Q&A, and then we're going to bring in an interesting speaker from Carm Build, a company that's a sister company for Carm Solar, for those who heard of it. Tell us about مستشفى ميدانية هم عملوا الديزاين بتاعها وخلوه open source. And then we're going to go back to our speakers and experts, have a discussion. Finally, we're going to end with a quote from Khalil and a teaser and a huge announcement about next episode, which we just heard about a few minutes ago. So stay tuned till the end to hear about what we have done. Special thanks goes out to Eva Pharma, who are giving us this tool, this Zoom webinars platform to actually have a very cool interaction with you guys. So I'd like to thank Eva Pharma and Mark, if you're out there. Thank you so much for all your work so far. And definitely want to thank my team, Awilhum Yara, for creating the content and helping us come up with a structure for this, Jailen and all the marketing, and Rajia, and of course Johnny, if you're there, thanks for helping setting this up and editing the videos. And I also love to thank the speakers, but you're going to know exactly who they are in a second. Finally, the last thing I want to say, we're very excited to announce that T20 is offered to help, and we're going to be cooperating with them on their initiative in promoting health and wellness. So they are working on bringing the best minds together to really fix a lot of problems in Egypt, and we're very proud for their support. And finally, without further ado, I'd like to introduce Dr. Khalil Abdel. Dr. Khalil is a pediatric specialist. You all have probably heard about him before. He is a visionary from a very old time. He has started Tabibi, which is becoming a very interesting company in these times. And he has also been a spark of inspiration for this webinar. So without further ado, I'd love to introduce Dr. Khalil Abdel, and I'll see you guys at the end of the webinar. Have fun.
Thank you, Omar, and thank you, Health 2.0 team. And it's really great to be with you tonight. Speaking of co-creation, if you allow me to share my slide, that would be the first step for co-creation. And here we are.
Nice.
I love actually to be with you today and to be with friends, with amazing people doing amazing things all over the place. And just with one initiative or with one vision that they want to help as much people as they can. Today we will be talking about resetting the healthcare system. Where do we go from here? Is it a great reset like Omar mentioned? And today we will focus on the outpatient care, having two of the leaders from Dewi Clinics and from AXA One Health. And that would be a very good, interesting talk. How did the COVID change their practice? Are they taking anything with them to the future? How do we collaborate? How do we partnership? Things like that. So all of us have a BC, DC, and AC, I guess. So before Corona, we used to be so happy with the waiting rooms. DC, we are fascinated with the PPEs and with social distancing. Married to a psychologist, I'm not allowed to say social distancing. I'm allowed only to say physical distancing because we can be socially connected even more. And AC, after Corona, are we gonna be doing masks, or are we gonna be doing something more interesting and something more hype than that? I hope that. So the resetting patterns, there are 3 resetting patterns, or 4 actually. So there is a V shape. So it couldn't have been better for someone like Netflix. It went down, then up again, and up majorly, and everyone is using it. And then we have a U shaped where it goes down, stays down, and then goes up. Or is it the dreaded L shape? And what is amazing is actually it can be none of them, and it can be actually the W shape, which goes up and down and up and down. So 4 shapes, and beware, because this will be the poll at the end. Whether will it be a U shape? Are we gonna go down, stay down a little bit? Are we gonna go down, bounce up? Are we gonna go down and up and down, and see how things are gonna move? Uh, a black swan event is something that changes everything, and some of us are familiar with that term. But what I would like to talk about actually is the silver lining, the opportunity in a crisis. Do we see the opportunity in the crisis? Do we benefit from this opportunity? There is a silver lining even when a storm is coming, and this is where we should be focused in. And in healthcare, I think that we have been blessed by this to be tested, to take us to our limits, to get us out of our comfort zones. The challenges we are facing in terms of the fragmentation of healthcare ecosystem really showed up now. And I think there is no better time than to stand together. We are definitely in the same storm, maybe not in the same boat, but definitely in one same storm. And the fragmentation has a lot of beauty in it. You can see the beauty in this drawing, but it is fragmented. What if we could smoothen the lines and make it a much more collaborative ecosystem? And from last webinar, if you attended with Riyadh, and he mentioned you are as weak as the weakest part of your ecosystem. Trying to achieve anything, you need an ecosystem that supports that. We need to support each other, stand with each other, and innovate together. And as I said, we are all not in the same boat yet, we are in the same storm. So partnerships, collaboration, and really working together is the key. Match made in healthcare, as I would like to call it. I'm so happy to be with May Rose Doz, the COO of Dewi Clinics, and Shokri Asmara, the CCO of AXA One Health. And for your information, AXA One Health is a provider. So AXA, as an investment body and as an insurer, invested in a service provider called AXA One Health. And Shokri Asmara is the CCO of this entity. And to me, they're very dear friends. And I'm going to start soon asking them questions to understand how the COVID helped or didn't help, and how are they coping with that. I need to remind you quickly, is it an L going down and staying down? Is it a U going down, staying down for a bit and going up? A V going down, rebounding up quickly, hopefully, or a W going down and going up? And I leave you here for the first poll, I guess. So we see that the majority of people think, or 64% think we're having a W shape. There will be several ups and downs moving forward. Maybe lots of silver linings, maybe lots of out of your comfort zone kind of challenges. Welcome, May Rose Dos, and welcome, Shokri Asmara. Can I start with the first questions? Are you guys ready? So how did COVID affect the day-to-day service provision for you? Is there anything that changed?
Thank you to Health 2.0 for having it. It's really, really nice to be here with Khalil and Shukri. As Khalil mentioned, personal friends. That picture was taken on a bright and sunny day in Alexandria. I hope that we get to have a picture like that again soon. So regarding COVID, it's been a very challenging time, both professionally and personally for everyone. I'm very proud of what our team at Dewi has done for pushing through this past few months and a half and being there for our patients. In mid-March, we came up with a crisis management plan that had all different indicators as to related to the spread and risk of COVID-19 in Egypt. And these indicators had a specific action plan that was communicated to the whole team. And every time something came up, we had a clear action plan to go through. And that, I think that made us it made all these different changes smooth. It made us able to stay on track and provide our services to patients in the midst of all this uncertainty that we're all going through. The safety of the team and our patients is of course the top priority here. We suspended a lot of work on non-urgent cases, especially in dental, during the month of April, and that of course was a big hit to the business. But I think we will see a V curve in healthcare. Healthcare is one of these industries that's very that comes back strong. It's a basic need that everybody needs, and I do think we'll see a V curve in that. With curfew, of course, related to what other changes, what has happened also with curfew, with Ramadan hours, we've had to shorten our working hours. We usually run our clinics until 10 p.m. We've now had to close at 5. And that was a challenge also to schedule our patients efficiently so we don't have a lot of people in the clinic at one time, to provide the same services, to push out some of our services through telehealth, to rearrange our staff and come up with different staffing models to be able to be there for our patients. I don't think any other major changes. I hope that has answered the question.
Flawless as usual, Rose, and thank you very much for telling us this. But can you tell me more about Dewi's services? You've been growing by the minute. Every time I go to sleep, I wake up, there is a new branch.
Don't go to sleep for too long. There'll be 10 new branches.
I stopped sleeping.
We currently have 10 branches. During the COVID outbreak. We've had to close one of them that is in Wadi Degla Club, which is closed by regulation, government regulation. We also postponed the opening of our first branch outside of Cairo in Tanta. So that was a big challenge coming up, and we're hoping to resume expansion hopefully right after Eid in the next coming few weeks. So 10 running branches and more to come this year.
Great. Shukri, Asmar, tell me about Exa One Health and tell me, how did COVID change you, or how did COVID push you, or were you ready? Were you planning for this outbreak?
We were planning for it, but not now, in Q4 maybe.
Okay. Came a little bit early, huh?
All our detection tool did not detect it, except actually, yes, maybe we acted maybe a little bit earlier than others because we are part of the AXA group, and they pushed us to act a little bit earlier due to the outbreak in Europe, much severe, especially in France, in Spain and Italy. So it was group regulations to push us to act maybe a little bit faster than the normal in Egypt. And it's very similar to what Mayros said. We had our crisis committee that is focused on how to do things better, protect people and protect our employees. And a big hooray to our frontliners working in the front lines, in the clinics till today. Yes, on reduced working hour, yes, on reduced personnel, but we continue to serve our clients. We had at the beginning the confusion of we were just opening some of the branches, the second branch, and it's either encourage people to come or to tell them no, don't come and stay home. And very quickly we shifted or accelerated, as we will talk today a lot, accelerated the plans we had to go on retail for digital health, because we already do retail. We do digital health for our insured clients for the last 4 or 5 years, 5 years actually. So now we accelerated it and launched it on retail, and we are giving the alternative to our booking clients to switch to a teleconsultation either by phone or by video up to their ease. And we did that quite quickly. We launched it, I think, around the 15th or 16th of March, which is quite early in the process. But because we've been having already the platform, so that's a luck for us. And the idea is to keep serving the walk-in clients, which do not stop. Keep the physical distance, as you say, Khalil. Keep the hygiene approach. Educate the clients when they come, and have a right approach with our staff of nurses, coordinators, and doctors to keep a smile, keep the right approach to the client, to not panic them more than they are, especially if they feel some of the symptoms. And to set that, so it's a strong shift in what can come earlier than what we expected as AXA One Health, to accelerate the steps of the digital health faster even than when we were launching that on a step by step. We think, and I think we will talk about this today, serve our client anywhere they are and in the mean they want. Definitely, it's a tougher situation on the offline visits and the clinics, but when you switch to digital, you compensate that, not from a revenue perspective only, but also mainly actually for this time, by serving the client when they need it and being there.
Great. So have a smile behind the mask while being physically distant. That's great, and definitely Shukri, always an inspiration, and always I wouldn't say with the ahead of the curve. Unbelievable, very nice. And I would like to ask people in the audience to ask questions. I can maintain some asking, but I will not continue all the hour asking. So please ask questions, and Yara will be following up on the questions. I think whether it's AXA One Health, it's Dewi, or luckily at Tabibi, we're so blessed to have great teams working with us. And I really think the COVID got us closer to our teams like nothing could have. Maybe not physically, not in one room, not Ramadan iftars and suhoors and small talks, but really the hard and really trying to change the game and trying to work on it. So adding to I think that bandwidth is king now, not anymore cash. So if you have the bandwidth, you're the king. This is what it is. So I think this is one of the challenges we have, and I think it's great. So I think it's time to move to the second question. Any of the changes you have done? I'll start with Shukri this time, Mayroz, because let's take him when he's hot and talking about AXA One, and he gets the biggest smile on his face, which is amazing. Any changes that we have done? Would it continue moving forward?
I think yes. It's when we launched, we were very conscious on a lot of training regarding relationnel with clients, regarding hygiene, regarding certain standards. And I think with what happened, it made our life easier to this approach with the clients, with the staff we are hiring and joining within the trainings, even if now the trainings are online. But it made it easier. And I think this consciousness of perfectionism a little bit more than the normal practice of healthcare services is gonna increase everywhere now. To take care of the steps you're making, following the protocols, following the guidelines, much more in a more convinced way than rather simply doing it to do it. And I think it's not only for our team, but around the country and around the globe, this became a better approach. Things that will stay is that the clients are more conscious of their health, and I'm talking clients because we always talk about customer clients, not about patients. because we don't only treat sick people. We try to fully have the journey with any customer regarding their health when they are well, when they are sick, and when they are after they get sick. So the consciousness about the health education and being healthier and protective of doing things that will harm your health is better. So it makes also our life easier in terms of the introduction of the new approaches all of us here around the table are trying to make in the primary care sector and the secondary care sector as a change. Moving to the third part, which is digital health, and I think digital health is the future by any means. But we have a strong belief, and I think we still have the strong belief that it cannot happen alone. It needs to happen between online and offline. So to have what people are used to, the medical center or the clinics like in Dewi that support the clients, but also support them everywhere and support them digitally. And also what happened with COVID-19 accelerated the acceptance of such approach. Yes, we have been very lucky that we have our insurance sister company in Egypt that through our service has been dealing on teleconsultation for a while. It's a plus, it's an advantage. But now even we are seeing this in the non-insured population we are serving, that they are starting to be gaining the trust toward teleconsultation, a video consultation. Yes, we do it when we are squeezed, but we are not used to do it when we are at ease. And they are seeing the benefits where you don't have waiting time, you have access to the doctor directly, you can explain what you want. And definitely it has its limitation. So that's why the complementarity between the physical clinics and the digital health future is there, but it has been accelerated, and I think this is a chance for this future of primary care that we are all trying to make.
Great. So I guess two great points right there. I got let's end sick care and start real healthcare, and the other one is digital health can be performed in a hybrid way. So Rose, what's your take? What are you taking with you post-COVID? What did you pack in your post-COVID bag?
We've definitely learned some clinical, more. I'll take an example: infection control audit measures. So we've learned more measures because of the situation we're in now, and this is something that we want to keep on doing. It's a new skill, it's a new process that we've learned inside the clinic, and something like that is very useful to take on to the future. It's not just limited to COVID time. One of the things that we did was move our call center to a work from home situation, which was very challenging, but we were able to do it successfully. And this has opened up new employment models, more flexible contracts with people. This is something we'd also like to maintain. I think one of the things that I'm very happy that happened is that there's a newfound appreciation of our electronic medical records. So since day one, we've been using electronic medical records for all our clients, and having to move to part of the service being remote on telehealth, the whole team now appreciates the fact that we have backgrounds of patients that are calling with symptoms, that we're able to check what kind of medication they're on. And I think this is one of the things that we gained as an organization, an appreciation of going digital from day one and maintaining it across all the different branches. Khalid, we were speaking about clinic reviews and meeting with doctors online. That's one of the other things that I think will definitely be taking forwards. I'm one of these people who likes personal meetings and is negatively affected by this social and physical distancing, but it has proven to be a very efficient means of reaching the whole team. We have a team of 120 doctors right now, reaching them all, bringing them all in at the same time, cross-checking, not at the same time, I mean, but having different meetings, having them all attend was very, very challenging. And during this phase, we've moved to online meetings, and that has given us a lot more attendance with the doctors, a lot more, so they've given a lot of input on what was going on. And as you said, Khalid, it was a good chance to connect with the whole team and build a very warm connection with everyone. So taking that with me.
Indeed. So definitely people working from home opened a lot of possibilities to people that couldn't work, and emptied actually more space for people that need to be client facing or patient facing. Electronic medical records are paramount, definitely. And those virtual meetings, although they were amazing in the very early DC period during COVID, but now it's so common when you ask people for a meeting, they tell you, sorry, I have a Zoom meeting. It's a little bit funny that even now people are virtually busy, which is a new term that we're seeing. So I think I'm done with question 2, and I think that now we have a Q&A, and we need Yora. We've been getting some questions in the chat. Yara, can you help with the Q&A?
Yeah. So we have a few questions now in the chat room. One is directed to Shukri. It says, why do I need to put my ID number in AXA One Health to try the app? I don't know. That's Ismail Badran.
Yes, Ismail. Yes, I read it on the chat. So hi Ismail. Heard a lot about you. We didn't meet physically, but yes. So I assume you are talking about the My AXA app, and the My AXA app has health feature, but it's mostly the health insurance feature. It's the insurance side of the app, and yes, they require the national ID to identify the client and identify what he's allowed to do on the app and what he's not allowed to do on the app. For us, for the AXA One Health app, you can use the app without the ID, the national ID, on everything that is allowed to be used without the national ID, up to the point where you need to have an access personally to your medical record. When you have an access to your medical record, it's a must that there is a verification that happens with the national ID for data privacy. Because we are part of AXA Group, and because we are obliged to follow the European regulation for data privacy, we need to have very strict control on the accessibility of the electronic medical record of any patient. We believe it's the ownership of the patient or the client himself. Yes, he can give access to another doctor that is outside our network, or he can give access to his family members, but we don't have the right, and we need to protect this data quite strongly for him to feel safe with his electronic medical record, his electronic data, even his demographics, but with much stricter approach to the medical data.
Thank you, Shukri.
I hope I answered your questions, Mike.
Thanks, Shukri. We have another question about the regulation of teleconsultation and virtual clinic from Mohammed Noor. Thank you, Engineer Mohammed. Engineer Mohammed is the digital health focal point of the WHO, and asking about how are you dealing with the regulation in Egypt?
Can I take that question, Yara?
Yeah, sure, of course.
Go ahead, please. You're the master.
I think we are very fragmented, Engineer Mohammed, and I think this is what me, May, Rose, and Shokri were discussing, and it is the collaborative work between us. We create our own policy. I think that the medical syndicate, نقابة الأطباء, and presenters in Ministry of Health are discussing a law to start now regulating it. So this and there is I think a webinar on Monday having the stakeholders to start looking into having a law implemented right on, because I think and it is, you know, if we're not going to use it now, when are we going to use it? I think we should be complaining about bandwidth and not regulations. This is the only thing we can complain about. But I hope that this answers the question. But I think the coming couple of weeks we'll be seeing very interesting time. I know for a fact that you're not allowed, even by phone, to prescribe anything except for a patient that you have already seen. So once the patient comes to Tabibi, or a Tabibi doctor visits him, we can send the record to May Rose, and maybe she can have a telehealth call with him I don't know, but this is where patient centricity will be the upcoming time. Patients can move from one practice to another as long as he can have his electronic records follow him. And I hope that answers a bit of the question and sheds some light to the near future.
If I may complement and start by a point you mentioned on Khalil, interoperability of electronic medical record can make this life easy. Let's talk about it later in the webinar. But definitely regulation are needed, Dr. Muhammad, to a little bit of control. Yet we need to follow certain guidelines that have been the experience of our global or different countries that have applied such a regulator and such a regulation and such a control. There are things that are limited that you can do during, and I'm not a doctor, I will leave my roles also to complement with Khalil. There are things that you can do in a teleconsultation that are more things that you can do in a video consultation, but both do not give you the full examination as a physical consultation, definitely. But we believe, and with the numbers we have globally, that 60 to 65 of the general practice or family immediate practice thing can be solved with over-the-counter medication that can help the immediate situation of a customer on and I'm talking here about family medicine. For specialties, it's required definitely more and more depth investigation, but definitely it can direct to lab or radiology approach that can help the doctor take a decision before prescribing any medication. And we are proud to be part of the American Teleconsultation Association, ATA, as AXA One Health and not as AXA Group. So it's something that was initiated with AXA One Health, and it is very beneficial to be part of understanding different guidelines in different countries, part of ATA and part in the Gulf region where they are very advanced in that also.
Yep. And actually, tele-training is the thing that really helped us as well. Shukri, continuing a lot of new guidelines that change day by day. Doctors all over the place. I was very happy to take our Tabibi Academy virtually online, and it helped a lot in managing the mental and the psychological part of the team, as well as the science and the practice of the team. So, Yara, do we have another question?
Yeah, I think we have two more interesting questions. One that came up previous to the discussions that was sent, and it's about
Yara, before you start, but I wanted to ask Engineer Mohammed Noor if you'd like to comment on that.
I'm not sure. Am I unmuted now?
Yes, we can hear you. We can hear you.
Okay, so when can I close it again? Can I close the mic again after that so that you can continue? Or
yes, we will close it for you. But from your perspective, from WHO, and I'm sure you guys are aware of what's going on with the Ministry of Health. Do you have any comments on that, or would like to tell us anything about how Ministry of Health is tackling telehealth from what you've seen?
Actually, I know that there are lots of fragmented trials in Egypt here, but from Ministry of Health's point of view, I think they feel that it's not there. I mean, they don't feel that it exists at all in the market. When you talk with them, what are you doing about this? Where are the regulations? Are you going to permit, or are you going not to permit? They say that it doesn't exist, and we are not working with it. So this is what I heard from some colleagues and some friends who are working there. And I think the first step is to make sure that we have recognition of the value, and especially now with COVID-19, there is a recognition. And I know, for example, Ain Shams University are having some kind of virtual clinic, and through this virtual clinic, they respond to patients to reduce the clinic crowdness and make sure that no one comes to the clinic except if they need really to see the doctor. So I think, at least for the time being, this is one of the important values of having telehealth or teleconsultation. So it's kind of helping in reducing the face-to-face contact with patients. Actually, I like very much this kind of discussions that is bringing ideas together. But most importantly, that we need to see what is the context in our country and how we can make this available for everyone and make it this building the value for integration with what the government is doing. I know it's slow in WHO, it's slow in the government, but initiatives like what you are doing is something that requires to be coming together in something that is recognized, that people see that this is something that we have to press and to ask for regulation to make this happen in a formal way. Thank you. You can unmute me now, and I'm listening after. Or you have any question? I'm ready.
Thank you, Engineer Mohammed. Can you tell us about the WHO's efforts now on telehealth? Are you pushing towards more regulations of telehealth?
You know, WHO cannot push something. I mean, we cannot enforce something for
yes, of course,
countries to adopt. We had an expert consultation about 2 months ago, and during that we have some experts who talked about the telemedicine and teleconsultation as part of the discussions in the expert consultation, and we didn't see that it is much recognized in our countries, not necessarily in Egypt specifically. So we know that, for example, Morocco had some initiatives, but they say that even they didn't allow someone from inside Morocco to take consultation from outside, even if it's possible. So the components of digital health is not only the technology, it's not only the bandwidth, it's not only the infrastructure. You need to have all the components coming together to serve that you would like to implement digital health, and you need to engage the decision makers and all stakeholders within the country to make sure that you can move forward with it.
Thank you very much, Engineer Mohammed.
Thank you.
So I think thank you, Engineer Mohammed, and I think we need to learn from others. So I think people doing work in global warming and climate change, I think they should have given up much earlier with nothing changing. I'm sure COVID helped them, but they continued pushing and pushing. And I read recently an article that those meetings that happen, they're kind of painful because it's just meetings, recommendation, and nothing really happens. But again, not giving up, and regardless how painful it is, I think we need to embrace it with love and move forward, and it will happen, I'm sure, one day. It's very early on. I think the first video conference call happened in 1964.
Wow.
So we're not really doing something that's new. We're just bringing it back. Sending a man to the moon, if he gets sick, we need to give him some telehealth. So I guess it's there, it's being done. Regulations are definitely, and this is where collaboration and partnerships with all stakeholders is the needed thing. So Yara, I give you back the mic, the unmuted mic.
I think if we can take 2 more interventions, one from Dr. Wael Abdelal.
Yeah, Dr. Wael Abdelal has been kicked off the series Fiku Arouche. He's the medical director of the Magdi Yaoub Foundation and has been pioneering telehealth since a very long time. Dr. Wael, welcome back.
Hi, Omar. Zach, how are you? New York is looking better today. We have good weather. We had a walk in the morning. So
good.
With masks and with everything. So, and actually the COVID it's not the COVID, but it's because of the behavior of the people. So we have some control of it, but it's going to linger on, as we understand, for some time. I don't want to waste your time. So, of course, we've been in telemedicine since 2009 and in Egypt and abroad. And now we have actually, with the Ministry of Health, we have more than 200 active sites And it was because of regulation, as I said last time, that we preferred to prove the case under the umbrella of the Ministry of Health, so that we do not disrupt the technology itself. So, and now we have an ongoing 200 sites with Ministry of Health, Ministry of Higher Education, and Ministry of Telecom. It's one project. It's the Egyptian Telemedicine Network. And this is under regulation of the Ministry of Health. Thousands of patients, different disciplines from emergencies. Of course, with the COVID, we had to move lots of our sites to the مستشفيات العزل to work there. But, it's very successful, but with different rates in different specialties. Basically, as a second opinion type of consults. And it's fantastic. It's moving very well. The Ministry of Health does have knowledge of telemedicine at the highest level for several years. It's being accelerated now a little bit, and I hope that some kind of solid regulation comes out to allow for the private sector to work in a more relaxed form. Yeah. We have been working for this, and actually we have an Egyptian Telemedicine Foundation. But I hope that COVID can push it to move faster. We have been advocates for this. I've been member of the ATA from 2009, and now actually I'm a member of the Artificial Intelligence in Healthcare, which came out from people in the ATA who formed this new organization in the States. In the States, it's pretty much established. بعد COVID, it's even it's the norm now. لأن ما فيش primary care and even secondary care, home health, كل الحاجات دي, school health. So now after the COVID, with the e-learning, they're both moving. And in New York City, actually, Governor Cuomo got Mayor Bloomberg to take care of the tracing and testing. It's a big project. And he got Eric Schmidt from Google, his CEO of Google, to run the new telehealth and teleeducation programs in New York State as a whole. They're even bumping it even to the highest level. I hope we are trying to help for Masr Nahna to move things faster and get to the regulations. It's not easy. And برضو parties are so many, زي Ministry of Telecom, Ministry of Health, Ministry of Higher Education, and syndicate, and all of that. So, but I think we're getting closer, and pretty soon. I'm very happy to hear all the advances or innovation in the market, and I think Egypt should be positioned to be leading in this.
Thank you, Dr. Wael.
Yeah, I think آخر حاجة it's the broadband that really, if you have broadband, then you have, if you have the roads, then it would make things easier. Okay, thank you for that.
It's actually, thank you for this comment and always bringing what is new. And this is the perfect segue, actually, to the segment that we have next with someone from outside the healthcare industry completely. And funnily enough, Dr. Wael mentioned construction and roads. They are from construction. And Amr from Hakima had another question. We're going to get back to you. There's going to be another Q&A. وهندخلك أول واحد يا عمرو. But we are going over time. I'd like to invite Yara Abul Wafa and Sami from Carm Build, a company that is associated with Carm Solar.
I'm very happy to be introducing Sami again, as today we're having for the first time someone from actually outside of the healthcare sector, and now we'll try to understand how are they using their innovation for a core thing of the healthcare sector. So Sami, can you give us a brief about what is, I'm not sure, I would think some people here wouldn't know Carm Solar or Carm Build, so if you would give us a brief about it.
Yes, of course. Hello, everybody. Ramadan Kareem. Wishing you all well. I'm Sami Awa, and I run marketing and communications for two sister companies, Carm Solar and Carm Build. Quickly, I'll tell you a little bit about them. Carm Solar is an energy utility company. Some people in the industry consider us a startup. We as well. Basically, what we do is we provide solar energy solutions across the board for many different industries, industrial, commercial, retail, agricultural, and even residential buildings as well. We build, own, operate our own stations, and we generate, distribute, and sell energy across the board to anyone who needs it, on grid and off grid as well. That's Carm Solar, but the company in the spotlight here today, and with the project that I'm here to speak to you about, is our sister company, Carm Build. Carm Build is a unique type of architecture and design firm that specializes in sustainable architecture and efficient environmental design. The whole premise of Carm Build is utilizing materials and processes to develop new kinds of structures that are ergonomically developed for specific environments to complement and not disrupt spaces. So this is the company. Should I get straight into the project? Well,
yeah, can you tell us how did you end up being here today on a healthcare webinar?
Okay, yeah, it's quite the place to be. Okay, so what happened was that the leadership of Carm Solar, Carm Build, as the COVID-19 situation progressed around the world, being a company that's run by primarily paranoid germaphobes, we were looking for how to best ensure the safety of our employees and what sort of processes we should take into consideration or start adopting, while also, and most importantly, how can we support our community, our country, anyone who requires the need, using our expertise in fighting or combating the spread of COVID-19, or supporting patients or the healthcare infrastructures of the world with coping and treating COVID-19. So while we're doing the research and taking into consideration the kind of the expertise of Solar and Build and where our knowledge lies, we came across this very interesting example of an architecture firm from Italy, Carlo Rotti Associati. It's a very prominent architecture firm in Italy that produced a model or designed a model for a mobile ICU response unit that is capable of being built and deployed in any situation, primarily as an addition to hospitals to increase their ICU capacity. The model is very innovative, it's very ingenious. It's built out of refitted shipping containers. It includes 3 ICU beds, and this is basically a design profile for this innovation. As I said, it is a mobile ICU unit that this is its layout. And it connects to an existing healthcare facility to increase its ICU capacity. So once, and this design was pushed out and it was adopted by the Italian government because they had a very big problem with ICU capacity. As you know, Italy faced a very difficult battle against COVID-19 as well as its healthcare infrastructure. So this solution was adopted by the government and implemented in healthcare facilities. So while we're doing our research and we came across this example, this was a perfect example of where Carm Build expertise lies. We're talking about unique types of structures with unique sort of dynamism and modular design that are easy to build, that are easy to construct, and constitute a fast and easily rapidly deployed solution for a problem like ICU capacity. We took the time for the last couple of months to compile a team of collaborators that involve members of healthcare representatives of the hospitals, construction engineering companies that have worked on developing or building healthcare facilities before. And we launched an initiative that we called رعاية مصر Initiative لإنشاء المستشفيات الميدانية لمكافحة مرض COVID-19, or the رعاية مصر Initiative for combating COVID-19 with the design of temporary ICU field hospitals. This is the hospital, by the way. If you guys can see it, I think I'll minimize this. If you guys can see, this is layout of the hospital. I'll walk you through it a little bit more about the details of what we did here. But when we're talking about the objectives here of building a ICU hospital, this is where we're talking about. I think this paragraph here explains it the most. And we were talking about 4 main objectives, or 5 main objectives for the construction and design of this facility. First of all, it has to abide by certain specifications and regulations for a facility that can manage the spread or manage the curing or the treatment
spread of infectious disease.
Yeah, exactly. The spread of a highly infectious disease. It takes a specific type of facility to be able to manage this, and abiding by these guidelines and making sure we design a facility that can actively and progressively combat and secure the spread of this disease within the facility while treating its patients was the first objective. The second main objective here is about the speed and the feasibility of developing this solution. So field hospitals are not necessarily supposed to be a very rapid response solution for an entity or a country that is facing immediate danger. And this hospital or this design being a fast mobilization and the construction for the facility or being rapidly deployed as a solution was one of our main objectives. This is why we've managed to develop an architecture design and construction methodology that can be executed between 10 and 15 days. So of course, fast mobilization and construction was the second point. So it has to be really quickly. You can really quickly develop it. And the second point is that all the materials and resources that you require to build this hospital must be available locally sourced. So the objective was to develop the design that is modular. And by modular, we mean that there will not be a one-size-fits-all solution or space for a 3,500 square meter facility to be deployed anywhere. So the design, which is, again, you can see here, is actually designed in a way that any of these wards, whether the triage, the actual ICU or U wards, the management facility, even the morgue and others can be repositioned and respaced to fit many different types of sizes and can even be expanded into double, triple, and even quadruple the size of this hospital.
And I think we have an important thing to say here, that you have done this as an open source. So actually, anyone who would like to see it, replicate it, is there. It's there online on the website. If you
want to visit it, you can download the entire architecture, design, and methodology for the hospital. It's egyptcarehospital.com. Thank you very much for your time, everybody.
And I think it's a great example from an innovation from outside of the industry on how they're using their best skills to deploy it to healthcare. But anyone who has been involved in building a hospital knows how much partnerships it takes and how many people from different parts, from engineers, designers, architects, healthcare planners, healthcare professionals need to be there to actually make it happen. And this is the first step for it.
Sammy, this is a great inspiration and it's amazing. And I think it answers my next question. Is COVID an obstacle or an opportunity? I think it is a great opportunity for Carm Build and a great inspiration. Thanks. And I take that question. So my Rose, is it, let's ask everyone, is COVID an obstacle or an opportunity? I'm sure for Carm Build, it was an opportunity, but let's see for others how it is. And mind you, we as panelists, we cannot answer the poll. So lucky you can answer. And Omar is very strict on time, so you have 20 more seconds to answer.
I'm slowly meditating and relaxing into minutes, according to Khalil's suggestions.
It's great being with you guys tonight.
Same here.
Yeah.
It's very homey and cozy. Thank you guys for making it very relaxing.
Is the poll up already? I can't see it.
Yeah, we're gonna close it in 2 seconds.
Oh, 90% opportunity. Wow. So why is it an opportunity? I guess I need to rephrase the question. It's your question. You say whatever.
There's always an opportunity in everything. So you just need to find the opportunity and find how we can relate it to what we're doing. This was definitely an opportunity for Dewi. We had been planning to launch more services through telehealth, and the COVID situation has just pushed us to move faster and fine-tune the offering we had on the phone. And it's been a great add-on. It's been a great add-on for our patients. It's been a great add-on as a safety measure for the clinic. So we were able to screen patients on the phone before they came into the clinic. And that proved to be a good measure to have and to deal with any, to give them advice about any symptoms they had that were related to COVID infection, to answer any questions. So it was definitely an opportunity in that sense. It's also been an opportunity to follow up on chronic patients. So instead of doing follow-up appointments inside the clinic, we were able to do them on the phone. And I think being digitally enabled before the situation has definitely given us more opportunities and given us a stronger base to be able to deal with this. I think any organization that is not digitally enabled, any doctor who is not using an electronic medical record will definitely be seeing the benefit of using one. So definitely an opportunity in pushing digital health adoption for sure. I agree with the 90% of people who have polled for definitely an opportunity.
Thank you, my Rose. And as always, seriously, a leader that gives the example of taking care of your team first will take care of your business one way or another. And if you don't know, Dewi has 10 clinics. One of them is currently on hold because it's in a club, the first clinic in a club. Luckily, our new Giza clinic is just outside of the club, so we can still have it open. Lucky us. But definitely taking care and safety is paramount. So Shokri, opportunity or super opportunity? Let me rephrase it.
I think to complement what Meiro said, because I think we agree. It's as if we were working together, as one team, because it was exactly the same measures, exactly the same approach that we were seeing coming, but not seeing it coming because of a pandemic. We were seeing it coming because of the accessibility and increasing the reach of a patient or a client to the health services. And I think it increased as I've mentioned before, it's an opportunity because it increased the notion of being healthier, which is helping a lot the sector, grow in a more deep way as a lifestyle for people, which is serving our purpose as primary and secondary care. It's been an opportunity also on the technology side, not only for AXA One Health or for Dewi or for Tabibi, but on a country level, the notion of telehealth with the telecos, with the other startups has been there now, prominent. I see some of the attendees are prominent figures in that, and it's good to, as we always say, the three of us, no one will change this market alone, and it needs a collective effort for that, for introducing these new, better quality, better customer-centric notion to healthcare services. It remove and please, doctor, do not kill me. It remove the doctor being a king in his clinic dependency, and making the customer as a king in the middle, where everybody is trying to serve the client and get to have more accessibility. And this is what we have been calling for a while, for long, and we believe in it strongly. Maybe the pandemic of COVID-19 accelerated it, but it's an obvious future. It helped as an opportunity, definitely, but not only for us as AXA, but it's an opportunity for a country that need definitely better healthcare services all over.
Great. So DC is an opportunity during COVID that's going AC after COVID, and I think we will have some time for more questions.
Khalil,
please.
Let us ask you. Yes, you're moderating this, but you're on the same side of the panel also. So please, tell us what's your experience also in Tabibi on that.
My experience is definitely we have been trying to go into the, let's say, the video consultations and more. We are a call center at the end of the day. We offer home visits, so a lot of post-visit work can be done by video conferencing. We're using the hybrid model that you said. We screen people to make our team safe and the people safe with teleconferencing and video conferencing, and then we do it. We have been using the technology for an academy, and we have been using our electronic records to have all the information regarding the patients and discussing patients. This collaborative work could not have been without the COVID, I think, without just slowing down, working on the business and taking a step back from working in the business. So lucky me, this is all what I can say. And I'll take back my unmuted moderator mic and go back to asking questions. And do you think partnerships will increase? Whom should I start with? I'll start with the audience, actually. Do you think partnerships in the healthcare between different stakeholders in healthcare, whether it's insurance, hospitals, pharma, government, will increase or decrease in the AC era, the after COVID era? And again, it's 1 minute. Omar is very serious about that. And can we make it 1 minute and 10 seconds, Omar? This time only.
Okay, عشان خاطرك بس دكتور خليل.
Okay, good.
I think we've reached everyone's vote. We have it now.
Okay.
Yeah.
Okay, definitely it will increase. So your comments, Mayrose, what do you think of partnerships after COVID?
This is an optimistic bunch here.
Oh, yes.
Why the comments here?
Really optimistic people.
Good.
I think, Khalil, that historically medicine, and not just in Egypt, but also around the world, healthcare organizations work in silos, so they don't work collaboratively very much. On a clinical level, not all practitioners are taught to collaborate on certain cases. Specialties are very much disease focused. They're not focused on seeing the patient as a whole person. And I think, I definitely believe that a huge change will come in respect to that sort of status quo. I think the consumer is expecting more. The consumer wants to see more. And I think that will push organizations to move more towards that. In terms of getting better services, getting a better customer experience, and two, customer does not, the healthcare sector does not fall into different, even the way we ask the question, so it's insurance, and it's pharma, and it's providers, and it's outpatient, inpatient, and to the consumer, someone who's just unwell and needs care. And in that case, they all just see the whole bunch as one, and we need to find a way to be able to integrate that sort of customer journey throughout everything. I've had an interesting question come to me from Ahmed Morsi from Nebraska Technology before. Yara, you had sent a list of questions regarding mergers and acquisitions in the outpatient sector, and why we haven't seen so many of them. And I think we've seen M&A action on diagnostic labs, hospitals, And I think what's coming next, outpatient, the whole world is moving to a trend to pushing towards outpatient care. I think before or a few years ago, there weren't many players on the scene that were investable, that were organizations that anyone else could collaborate with. And I think the three of us are all in organizations that are trying to change that fact in Egypt. So moving from a very fragmented market to something that is more organized, that is able to give a proper customer experience. And I believe that the whole market will move towards a more patient-centric care with that direction, with all players.
So thank you, Bay. Going to Shokri, what do you think? Give us your...
Yeah, we've been here and we've pushed our shareholders to invest in Egypt as a start in the African markets because of that. We believe in it strongly. We believe this not total consolidation, but institutionalization of customer centricity to give better customer centricity. Because the fragmentation, the customer is completely lost in the middle between going to a doctor private clinic, then going to the radiology center, and then coming up with the big radiology and going to the clinic again, and then now to go to the lab. This is not customer centric. This is profession centric, and I think where we come is to as institutions to try to bring a very high qualified medical personnel, in my opinion, in our country, to a more seamless approach to the customer centricity in serving them. Based on the customer centricity, there is a worry always of the cost of being treated. And I will speak a little bit of my background before being part of AXA One Health with insurance. And I think the CA, I love the CA, the AC, sorry, era after COVID is the customer interest to be safe, worry-free about any disease or a health issue that he can get, will increase this notion of being protected. And being protected will only come not only by having a payer, an insurer that will pay the bills, but to have this integration, or what we call in AXA the vertical integration, with between the different provider and the payers, because it will not be a payer centricity, not to be a doctor centricity. The customer will be in the middle, and he will dictate what he needs, what he wants, not push product, but pull product to tell this is what we need, this is the quality we need. The notion of quality, hygiene, infection, etc., is much higher now within 3 months. And I think this is what will change. There will not be, if the situation ends in a month or two, the behavioral change will not be drastic, but the notion of these sort of better health, better hygiene, better approach, better quality of service to me is increasing. And I think this is where the opportunity lies for institutions to try to standardize a high quality of care without being based on emotions or high traffic clinic versus low traffic clinic, but no, based on the high quality that serve a client, and the client is the king, not the web bedwits. Actually, I always use another machine said I am responsible for the client side in our organization. That client is king, and he's how to serve him better, whether by removing his financial worry, by removing his logistic worry, by removing his trust issue toward the medical personnel. All this will require a lot of partnership, if I may say, a lot of alignment, a lot of consolidation. And consolidation do not mean M&A, in my opinion. Consolidation means total alignment and a consortium to serve the client. Sorry, I've been too long.
No, that's amazing. And as a coffee addict, I think if we take an example of buying a cup of coffee, compared to getting treatment in healthcare. So you imagine you going on asking for coffee, not seeing a menu, not knowing anything, not knowing the price, and then after you get the coffee, they tell you go and get the milk from another place. And while you're at it, you need to go and get a sugar from a different city, maybe all in all. And but the sugar guy doesn't come to his place except at 2 a.m. in the morning. This fragmentation needs to end, I believe, for a patient's well-being and for being in the business of health and not in the business only of sick care and healthcare. And we need to promote health. So if we don't make it as easy and as enjoyable as an experience of a cup of coffee, then we have a problem. Yara, we're left with more time for Q&A. Let's do that.
That's wonderful. It actually gives me space to ask a question of my own as I'm handling the questions. I was thinking as Shukri was speaking that he is Chief Client Officer, which is, I think, is quite a new position that thinks about a different direction actually of the private sector as a whole, to have a Chief Client Officer and a Chief Patient Officer. So can you tell us about this? And you were talking about moving from fee-for-service to value-based care and so on, but actually having a chief client officer is making it happen. And how do you make it happen? What do you do? How important is this role? And how do you actually, because at the end of the day, you're a private sector, so how do you actually convince the business of the ROI of it?
Yeah, so basically we are, as a team, the alarm within the organization of all what customer needs. So we built our offering based on the need of the customer, based on what even the customer need and doesn't request it, because some of the things you don't know what is not presented to you, but how to better serve the client. So it is an enjoyable experience, even when people are sick, they are really tired, they are really unhappy, and how to make this experience not even worse on them through the whole journey. So it's mainly on the customer journey, mainly on how to better formulate our offering, how to better design our facilities, how to better designs of our digital approach, so it can create a full approach to the client as a center, and that to fix all the operation, the medical side, the financial side, even all the compassion and care in all our stuff around one center, which is the client. So customer centricity at its very basic, from with all the spectrum of it, but it showed how we wanted to start this journey, not knowing that we have very good quality medical personnel that we can have as a team, but we wanted to be different, not to be different, but to offer something different that the client can feel as a human being, actually, and treated as a person that needs to be taken care of, and not the person that is asking for or بيشحت يعني of a service.
No,
I hope I answered your question. Yeah.
No,
and I'm very proud of this, of being part of the team with my colleagues.
Definitely, it's very exciting times now to see more and more healthcare providers having this type of position. And we move to the questions that we've been receiving. One, actually a few, is around the effect of COVID-19 on your business. So there is no doubt that that the footprint has been declining lately on clinics, especially. So do you think some specific services are doing better than others? Or how do you think this is going to affect your business? And specifically for Khalil, I'm addressing it to Khalil because you have home visits. How is this affecting home visits? And for all of you, how is this affecting the recruitment of medical personnel?
Actually, if I'll answer, I'll say it's affecting us in different ways. It's affecting us in indefinitely with the curfew time and with people's brains being really focused on the current situation, on the COVID, on the panic there was in the beginning. People actually, another crisis has been happening where people have been neglecting their health. I am really worried that AC after COVID, we're going to have a healthcare crisis from maybe more strokes when people did not control their blood pressure, with kids missing their vaccines, with diabetics not following up. The day-to-day, day-in, day-out healthcare services. We have been doing that. Some people are not doing it, and I was really till Cornbill talked about the ICU in a container kind of innovation. I was so happy to have implemented hospital at home initiative at Tabibi, but I think now there is something much bigger and much amazing what Bill did. But yes, it did affect us, Yara, but we practice slow medicine. As what Shokri and May have been saying, we're very patient focused. We try to give patients the time, and we believe that we can serve patients in multiple platforms. I am really humbled and honored to be in this industry. I love it. It's been running in the family. Luckily, with Tabibi, I can help more people. This is what has changed from my side. Luckily, I love what I'm doing. I'll continue doing it. And as the chat I was having with May Rose the other day, we are in an infinite business. We're not in a finite business where we will close if the P&Ls don't look good. We will manage, we will become lean, we will serve. We're there to stay, we're there to build a legacy of care and pass it to other generations, if I may say. In whatever way, digitally, physically, at home, in the hospital, on the moon.
And that's the attitude we're looking for, Khalil. So another question on what you're talking about the hospital at home. How are you linking this with the ambulatory service? How are you linking this with the hospitals? How are you integrating with the hospitals?
So luckily, we're part of Alameda Healthcare, which has Dar Al Fuad Hospital and Salam Hospital. So we definitely have an integration where we work with them. So actually, patients are not discharged home without care. They're discharged to have a Tabibi doctor and a Tabibi nurse following them in this, what I would call the orange era after the hospital discharge. So we have this partnership. We have it with other hospital and other practices. So we're not only having it with our partners, offering the best. We started seeing insurance company asking us for home care. We started seeing even governmental hospitals with chronic diseases asking us to offer care locally to others. We have been helping businesses around up gaming their health care of their employees. So as I said, health is an infinite business. It doesn't stop. It continues. And it's a passion job for everyone in it. Luckily, each nurse, each doctor, each front desk, each call center agent, each one really is helping maintaining the health of a patient, yet alone maintaining the health of a family.
Thank you, Khalil. Mayroz and Shukri, do you have something to comment here on how has it been affecting your business?
So definitely decreased footfall because of the limited hours. We're working limited hours, and that has been a big change recently. I have to agree very much with everything that Khalil has said. Yeah, you're echoing my thoughts on so many things, and I think you put it very eloquently and beautifully. And I don't think I have much to add to that.
Thank you, Mayroz. Precise as always.
No, I totally agree, and I have very little to add. And I echo the point of Khalil that we are in this business because of the passion, because of the mission. We feel not only the doctor and the nurses that are medical professionals, but all the teams are feeling they have a cause, a mission to serve around them clients and families and communities. And I think even with even if in our special case we didn't see the footfall decrease per se, because we were redirecting them maybe to reduce it intentionally for better service when it's not needed for them to come to the clinic, but redirecting them to more on a digital platform approach. But definitely it affected the growth approach and the launches we were planning to make. But it helped from another side, reshifting and reaccelerating other businesses we had in mind. So I think it's as a balance, it's more positive than negative.
Thank you, Shukri. Omar, can you put Amr on, please?
Oh,
so two innovators of the health industry are joining us.
Abdel
Amazing.
Latif and Amr.
Amr.
And Dr. Ahmed Mursi, of course. I see Dr. Ahmed
Yeah,
Mursi is
we'll
here
get to
then.
them with an announcement. بس عمرو من حكيمة, if you لو عاوز تعمل مداخلة معاك, you can talk now. You just need to unmute yourself. Please let us know if you're here.
Tell us how you did it within COVID and the support you give. Yeah.
I think we can take a quick break and move on to. Should we talk about the next episode or close with Khalil's comment? Or I mean, we can give Amr a few seconds if he comes back.
No, I think let's talk about the next episode.
Okay. Well, before then, Khalil.
Hello, let's do that.
Yeah, I'll give us Dr. Khalil a chance for a closing comment as our amazing moderator for today, and thank you so much for everything. عامة من غير Dr. Khalil فعلا we wouldn't have been inspired to do this webinars, and I mean this wholeheartedly. So thank you so much for the inspiration. Thank you for introducing us to Dr. Wael Abdelail, and for this very smooth and relaxed environment that you created.
Thank you. So if I may share my screen again, and here we go. And definitely, I really got inspired by Corn Build and what they have done. It's amazing. I hope we can find people that can fund this. We need this during COVID and post-COVID in areas where there are no ICUs. And I think it's an innovative thing. Healthcare should be everywhere. I'll end with a comment or with a quote. Definitely, I agree that patient is king, but bandwidth is precious, is very precious. And luckily, it is improving day in, day out. Historically, pandemics have forced humans to break with the past and imagine the world anew. This one is no different. It's a portal, it's a gateway between one world and the next. Let the next world be an amazing one. Let us help more patients on whatever platform that suits them. And definitely, again, thank you, Omar, for having us today. And I'd like to thank my dear friends, Mayroz and Shukri, for an amazing, actually, chat. And it is friendly because we are friends, I guess, before COVID, during COVID, and after COVID, inshallah. Thank you very much, everyone.